Do you know what pneumonia is and how it affects your body? Let's dive into this. Pneumonia is a common lung infection that can be caused by a variety of culprits: bacteria, viruses, or even fungi. These microscopic invaders cause inflammation in the air sacs, or alveoli, of your lungs, often filling them with fluid or pus. This can make breathing a real challenge, and if not treated, it can become a serious threat to health. Now, you might think this sounds like a rare, exotic disease. But no, pneumonia is a worldwide concern. From bustling cities to remote villages, no corner of the globe is immune. Every year, millions of people are affected by this lung infection, making it a major public health issue. So we've got the basics down. Pneumonia, a common yet potentially lethal lung infection. But what causes it? What are the symptoms? And most importantly, how can it be treated? Stay tuned to know more about the causes of pneumonia. Ever wondered what causes pneumonia? Well, let's dive in. Pneumonia is primarily caused by infections, with different types of microbes, including bacteria, viruses, and fungi, playing the culprit. Each type of pneumonia is named after the germ that causes it. Bacterial pneumonia, for instance, is most commonly caused by Streptococcus pneumonia. This form of pneumonia can occur on its own or after you've had a cold or the flu. It may affect one part or lobe of the lung, a condition called lobar pneumonia. Then there's viral pneumonia, often caused by the influenza virus. This type accounts for about 1/3 of all pneumonia cases. While it can be very serious, viral pneumonia tends to be milder than bacterial pneumonia and lasts for a shorter time. Fungal pneumonia is less common, but can be caused by fungi in soil or bird droppings. It's most often seen in people with underlying health conditions or weakened immune systems. But microbes aren't the only possible cause. Pneumonia can also be caused by inhaling liquids or chemicals into your lungs. Aspiration pneumonia, as it's known, often occurs if a person has a problem with their gag reflex or swallowing. For example, someone who has had a stroke might have difficulty swallowing. If they're not careful, they could inhale their food or drink into their lungs, leading to aspiration pneumonia. Similarly, inhaling substances such as petroleum products, smoke, dust, or certain chemicals can also cause a form of pneumonia known as chemical pneumonia. So, you see, pneumonia is not just one disease. It's a category of lung infections caused by a variety of different agents, each with its own set of characteristics and risks. Understanding these causes is the first step towards prevention and treatment. Next, we will delve into the symptoms of pneumonia. What are the signs that someone might have pneumonia? Let's delve into this. Pneumonia, as we know, is an infection that inflames the air sacs in one or both lungs. But how does it make itself known? Well, the symptoms can vary in intensity from mild to severe, depending on factors such as the type of germ causing the infection, your age, and your overall health. One of the most common symptoms is a cough. This isn't your run-of-the-mill tickle in the throat, but a persistent, often productive cough. By productive, we mean that it brings up phlegm or sputum from the lungs. The color of this sputum can range from clear to yellow, green, or even rusty. Another telltale sign is fever. When the body is fighting an infection like pneumonia, the temperature can spike. This fever can be accompanied by sweating and chills, making for a rather unpleasant combo. Difficulty breathing is another symptom to watch out for. You might find that you're breathing faster than usual, or feel short of breath even when resting. This happens because the infection in the lungs can make it harder for oxygen to reach your blood. Next up is chest pain. With pneumonia, you might experience sharp or stabbing pain in your chest that gets worse when you breathe deeply or cough. This is your body's way of telling you that something isn't right in the lung area. Aside from these, you could also experience symptoms like fatigue, loss of appetite, and confusion, especially in older adults. It's important to remember that these symptoms can be similar to other respiratory conditions, so it's always best to seek medical advice if you're feeling unwell. One thing's for sure, pneumonia isn't a walk in the park. It's a serious condition that requires prompt attention. But don't fret, there are ways to tackle it. So how do we treat pneumonia? Stay tuned to find out. Now that we know the symptoms, let's discuss how pneumonia can be treated. The treatment plan for pneumonia primarily depends on the type and severity of the condition, as well as the overall health of the patient. Let's dive into the different treatment options available. For bacterial pneumonia, antibiotics are the first line of defense. The specific type of antibiotic prescribed will depend on several factors, including the type of bacteria causing the pneumonia and the patient's overall health status. It's crucial to complete the entire course of antibiotics, even if symptoms improve before the medication is finished. This ensures that the bacteria are completely eliminated and reduces the risk of resistance. Viral pneumonia, on the other hand, is not responsive to antibiotics. Instead, it's generally treated with rest, hydration, and over-the-counter medications to manage symptoms. In some cases, antiviral drugs may be used. For those with severe pneumonia or those at high risk, hospitalization may be necessary. In the hospital, patients might receive respiratory therapy, which includes the use of machines to assist breathing or intravenous antibiotics. Regardless of the type of pneumonia, all patients are advised to get plenty of rest and stay well hydrated. Rest allows the body to direct its energy towards fighting off the infection, while hydration helps to thin out the mucus in the lungs, making it easier to cough up. Cough medicines can also be used to manage symptoms, but they should be used with caution. While they can provide relief from a persistent cough, they also suppress the body's natural reflex to expel mucus from the lungs. It's always best to consult a healthcare professional before starting any new medication. In addition to these traditional treatment options, it's important to note that prevention is key. Vaccines are available to protect against some types of pneumonia, especially for those in high-risk groups. Let's summarize what we've learned about pneumonia. The treatment for pneumonia can range from antibiotics to hospitalization, depending on the type and severity of the condition. Rest, hydration, and symptom management play a vital role in recovery. And remember, prevention, including vaccination, is the best form of protection. We've covered a lot of ground today about pneumonia. Let's take a moment to revisit some of the key points we've discussed. Pneumonia, as we've learned, is an infection that inflames the air sacs in one or both lungs. It can be caused by a variety of organisms, including bacteria, viruses, and fungi. The lungs fill with fluid or pus, leading to coughing, fever, chills, and difficulty breathing. It's a common illness that affects millions of people each year, but it can also be a serious and life-threatening condition, particularly for the elderly, the very young, and those with weakened immune systems. We delved into the causes of pneumonia, highlighting that it often stems from a bacterial infection. Streptococcus pneumonia is a common culprit, but other bacteria, viruses, and even fungi can lead to this condition. It's important to note that pneumonia can also be caused by inhaling a liquid or chemical into your lungs. We also discussed the symptoms of pneumonia. They can range from mild to severe and may include cough with phlegm or pus, fever, chills, and difficulty breathing. More severe cases may experience chest pain, confusion, or bluish skin color due to lack of oxygen. Remember, symptoms can vary greatly depending on the type of pneumonia, the individual's age, and their overall health. In terms of treatment, antibiotics are most commonly used for bacterial pneumonia. Antiviral medications may be used for viral pneumonia, and fungal pneumonia is treated with antifungal drugs. In some cases, hospitalization may be required, especially for those at high risk. It's also crucial to stay well hydrated and rested to help the body fight the infection. By understanding what pneumonia is, its causes, symptoms, and treatment options, we can better prepare ourselves and our loved ones. Knowledge is power, and in this case, it can be the difference between life and death. Remember, early detection and treatment can make a huge difference when dealing with pneumonia. Stay informed, stay healthy,